Alright, hello Mr. Carrier. My name is Paisley Roberts and I'm going to be your occupational therapist today. How are you doing?
I'm great. Would you please call me Paisley if you don't mind? Mr. Turner makes me feel very old.
Alright, that's fine. So, Chase, do you know what occupational therapists do for their clients or how we help?
I do not. If you could explain, that would be great though.
Okay, so occupational therapists, we use therapeutic activities to help clients return back to meaningful occupations in their life. So as we know, you've experienced a stroke and have been having some difficulties in your life now with some tasks. And so we're going to work towards getting you back to how you were maybe before your stroke to make those activities easier for you.
That would be great. I miss that old life.
Okay, so that's going to be our main goal and what we're going to work towards, all right?
Sounds amazing.
Chase, would you be okay with me completing some screens on you today?
Hey, if it improves me, I'm good with it.
Okay, so just a little background on what a screen is I'm just going to be asking you some questions and then maybe to complete some little tasks. And I'm just going to see if you can complete those things with your body functions working 100%. And if you get a positive screen, what that means is that you have an impairment present and that we will do farther testing with an evaluation. But if it is a negative screen, it means you're okay and you're good to go.
Sounds great.
So first off, let's start with me just asking a little bit about what you enjoy to do.
I like to fish. I like to read. I like to hang out with my dog.
Really?
Yeah, and believe it or not, I like to paint.
Awesome. What type of dog do you have?
I have a pug. He's my dude.
Awesome. I have a German Shepherd,
Oh,
so
cool.
he's a little bit bigger than a pug.
Oh, definitely. Yeah.
He's a big baby.
Yeah,
For
he
sure.
is. Yes, he is.
So I can see in your chart that you're having some difficulties with your vision as well as some pain in your shoulder
Right. Yeah.
and your thigh
That's
on
correct.
your left side.
That's correct.
So our first screen here, we're going to start with one that targets your vision.
Okay. Sounds great.
So oddly enough, this first screen has a little bit of like the dog theme
Cool.
to it. So like I said, it focuses on your vision, and I'm going to have you just read the back of this book here. So it's a book about dogs.
All right.
Just read that out loud for me, please.
Okay. Learn what goes. Do you remember where I stopped at? Having trouble keeping my place.
Right up here. So maybe just try putting your finger under the words that you're in and just follow along.
Okay. I'm going to learn what goes on inside your dog's mind and develop a positive relationship.
Okay. So are you experiencing any difficulty when you read?
Yeah, it's like I'm blurry. Can't lose my spot.
Lose your spot?
Yes, ma'am.
Experiencing any kind of like double vision or anything?
Yes, and double vision when I try to read, yes.
Okay, so I think you may be experiencing some decreased ocular motor control.
Okay.
So what that means, this is common for people who have a stroke.
Okay.
It's just to weaken some of the muscles around your eye. That those muscles help to keep your eye focused when you're like reading. So we would have to strengthen these muscles back through therapeutic exercise.
Okay.
And so in the meantime, while you're still having like some of this vision difficulty, we want to make sure to think of safety precautions such as like having your home pathways like clear so there's no like clutter. So we don't want you to trip and maybe have like a fall.
That wouldn't be good in these bones.
No, so just something as simple as clearing your house pathways can help you. You think you can do that?
Yeah, I can do that.
Okay, perfect. So, and like I said, to help you regain the strength of those muscles, we would, a therapeutic exercise that we could intervene would be maybe like playing a game, or we could do like visual tracking, so that would help to strengthen those muscles back and regain.
That sounds great.
So for our second screen, this is also going to be a vision screening.
Okay.
For this one though, I'm going to have you use dry erase markers and this dry erase board. And I would like for you to draw me a picture of maybe something that you've painted. Or
outdoor scenery or something like that.
Yeah, something
Nature.
you enjoy.
Cool, that's what I like to paint.
Perfect.
Let's see.
I'll get that.
Okay.
For you.
How about a sun?
Perfect.
Great.
All right, and can you kind of hold that up?
Yeah.
Perfect. So, are you all done with that?
Looks good to me.
Okay. So, would you mind drawing me another outdoor scenery?
Can I draw like trees and birds, maybe?
Yeah.
Something like that?
Here.
Oh, thanks.
I'll take this from you.
Okay, cool. Bird. Use this marker if you don't mind. Do a tree for you. There you go.
Okay, all done with that one too?
Yeah, it looks great to me.
Okay. So what I've noticed from these two drawings that you did,
Yeah.
it looks like you are not completely completing your thought here. It looks like you on the left side of the picture are having a little bit of left neglect, which is also common with stroke patients.
Okay.
So this is also called hypnospia.
Yeah.
And so that's just a fancy word
Okay.
for left neglect.
Sounds
So-
pretty fancy to me, yeah.
So all that means is, like I said, you're not completing your figure of what you're saying, so your vision is being affected.
Okay.
So how we would work to possibly intervene in intervention to help with this is actually, it's pretty cool. It's called mirror therapy. So we would set up a mirror beside you to where like one hand is on one side of the mirror and the other hand's on the other side.
Okay.
And we would have you do a small task of where you had to move something across, and our hope is that your vision, you would see it in the mirror as well as correct yourself over time.
That's a great idea. I haven't thought anything like that.
Yeah, so it's a really, really neat idea. So it's also important to take in consideration your safety precautions still. So
Okay.
this is affecting your overall vision.
Okay.
So kind of like I was saying about keeping your hallways clear and stuff. Same thing with this. Just avoid anything that could potentially cause you a fall risk. So I even like to tell some of my clients if they have like a sharp granite countertops or
Okay.
a really sharp table in their living room, maybe take like foam and put it around that edging so you're not bumping into that and hurting yourself in case you don't see it.
Yeah, I'll get my son to do that for me.
Yeah, that would be great.
All right, great. Thank you.
Okay, so how are you doing? You still hanging in there?
I'm great. Just wondering how I can get better.
Okay, so we still have 2 more screens.
Okay.
The next one, we're going to focus on the shoulder pain that was in your chart, okay?
Okay.
So it's your
Left shoulder.
left shoulder that's
Yeah.
been bothering you some.
Mm-hmm.
Okay, so I'm going to ask you just do a simple task here.
Okay.
One by one, so your right arm first and then your left arm.
All
I'm
right.
going to have you put your arm out, then to the side, then up, behind your head, and then behind your back like this. Good. Okay, perfect.
Feels good.
Yeah, so let's go ahead and try that with your left arm.
So straight first.
Yep, so straight out. Good job.
What's the next one?
Try to go to the side there.
Like this?
Nope.
Oh,
This way.
out all the way.
There you
Yeah,
go.
it just really hurts. I don't know if I can do the rest.
Alright, you could stop if it hurts.
Oh, yeah, it hurts.
Can
bad.
you go up? Not really?
Yeah, I'm
Okay.
kind
And
of
we won't
tight.
even attempt how about the behind the back
Okay.
or the head. So, what you're experiencing there is something called shoulder subluxation.
Okay.
So that is basically, again, another common thing that happens with stroke.
Okay.
You have weakening muscles around your shoulder joint here, your ball and socket joint.
Okay.
So that shoulder is experiencing pain. It's kind of having to overwork, so to speak.
Yes.
So again, with therapeutic exercise, we would try to strengthen that. That's
so it can be fixed then, or
it
be
can,
improved.
Be improved,
Okay.
yes. And if we were to start those therapeutic interventions and you were not improving, it can be fixed with surgery.
Oh, okay.
But the therapeutic exercises is where we would start, kind of thing.
Okay.
And so you can just tell there that you have not as much strength and range of motion in that left side versus your right. Okay?
Correct.
And that's all because of your stroke. So in the meantime, again, before we start doing our therapeutic exercise interventions and stuff, and once we get to that evaluation, just in the meantime of all that while you're healing, I just wanted you to be mindful of safety precautions. So just because you have a weak side there, make sure you're utilizing your strong side here, as well as just making sure of those fall risk precautions that we talked about earlier, of keeping your pathways clean and stuff like that. So just knowing that side's weaker and kind of protecting it from any kind of trauma or bumping it around or anything like that. Just protect it, basically.
Okay, sounds good.
All right. We're going to move into our last screen of the day here.
Okay.
And we're going to target that pain that you've been having in your left thigh.
Okay.
Okay. So much like the last screen we just did about the shoulder, I'm going to have you do one leg and then the other, so separately. So the movement that I'm going to have you try is starting with your right leg here. I'm going to have you bring your leg up and then out.
Okay.
Okay. Let's go ahead and try that with your right leg.
Up and then out.
Out. Perfect.
Feels pretty good.
Okay. And go ahead and try it now with that left leg.
Okay. Just feels real tight.
Yep. Okay. So some struggling, weakness there.
Yeah, for sure. Weakness.
Okay, so what you are experiencing is an increased flexor tone in your bicep femoris.
Okay.
So that is a big muscle in the back of your thigh, and it's common again with strokes that it's affected this side of your body, that muscle has gotten tight. Okay, so how we would intervene with therapeutic intervention would be therapeutic exercises.
Okay.
And we would start off with stretching and trying to break down that tone. Okay, so then we would get you to where you could use this leg without that pain that you're experiencing right now. And again, much like that shoulder, just your safety precautions are going to be being aware of your weakness right now in this this leg and just in general of your left side of your body, and just kind of protecting that area for right now.
Okay.
Okay, does that sound all right?
Yes, you did a great job explaining it. You better watch out, you end up like me.
Yeah, all right, so we've completed all of our screens for today.
Okay, great.
Yes.
Ready to get out of here, honestly.
In our screens today, we did find some positive screening. So that means that we did find some impairments, which, like I mentioned at the very beginning of the session, that means that we'll want to do some further evaluations to just really pinpoint where we should take your therapy interventions.
Okay.
And that's just to benefit you. So
right.
We want to make sure that whatever interventions we're doing for you during therapy, they're really going to target your impairment and help you the best that you can. Okay? So, I know today was like a lot of information. Those evaluations, two of them that I would recommend. One is the visual perception assessment program, which would be for your vision impairments. And then the other one would be the River Mead motor assessment, which would be for your extremity weakness that you're experiencing.
Yeah, sounds right.
And like I said, I know this is a lot of information to take in all at once. So do you have any questions for me about today or how things went?
Not today. I think you did a great job explaining it. So.
Okay.
Really
Well,
appreciate it.
thank you. We try to do our best, and we'll work really hard to get you back to how you were before you had your stroke.
That's the goal.
Yes,
Everybody wants old Chase back.
So I will see you next Wednesday
Okay.
for our next session, which, like I said, we'll start evaluations at that point.
Sounds great. I'll see you then.
All right. You have a great day.
You too. Bye-bye.
Bye-bye.